Hi, my name's Kelly. I'm your baby's nurse today.
Hello.
How are you?
Good.
I just want to go over some breastfeeding information with you. We want you to feed effectively with the breastfeeding. So effective feedings ensure that the baby gets enough milk and may prevent engorgement. So we try to get a deeper latch, which improves the feedings. And if you're feeding frequently with a deep latch, it helps build your milk supply. It helps the baby stay hydrated, and the baby will lose less weight. And then you'll have more wet and poopy diapers. So we have listed here, and you can look at this later, but it tells you effective feeding versus non-effective. So a couple examples would be if your breastfeeding is not painful, then it's effective. If you're having some pain, then the baby may not be latched on very well. Also, the sounds that you hear, a swallowing sound, like a K sound, is normal when the milk comes in, but if you're hearing the lips smacking and a lot of sounds coming from the baby, the cheeks dimpling in, we would prefer the cheeks to be rounded and for the feeding to be a little bit more quiet. So you can look for those two things. And then the other ones are listed here as well. Now we're going to go to how to track your feedings and to determine if they're effective or not. And we can go over here to the log. You'll use this feeding and diaper log to help you decide if the feeding is well. You're going to document how often you're feeding, the quality of the feeding, and the number of wet and poopy diapers. So you'll write the time and the duration of the feeding, the minutes on each side. You'll write the time in the boxes for the wet and poopy diapers, and this will give you a guideline for each day of life, how many wet and poopy diapers to expect, and also what color the stools should be. So if you are not having, when you're home with the baby, if the baby's not having the wet and poopy diapers that are listed here, then you would definitely want to call the baby's pediatrician. One thing on the chart here is the feeding quality, and you have to determine that. So we use 3 points to determine that: how comfortable the feeding is, the sucking for the baby, and whether the baby sustains the latch. So an excellent feeding, for example, the latch would be comfortable, the baby would have nice, nutritive, strong sucking, and would sustain the latch. A good feeding would be mostly comfortable, the baby may come off but will relatch, and may be sleepy but there'll be nutritive sucking. Fair would be uncomfortable for the most part of the feeding, the baby may not stay latched on, rarely will latch on, will be more off the breast than on, and the sucking may be weak, and the baby could fall asleep and have very short feedings, 2 to 3 minutes. A poor feeding would be no latch at all or very painful latch. The nipples could be damaged, cracked, or bleeding, and you would have very weak sucking or no sucking at all. We really want you, obviously, to have excellent feeding. So if you're having consistent poor or fair feedings, you would always want to let your nurse know so we can help you achieve that. And then how you can achieve that is on this page here, you can refer to its position and latch. An effective feeding requires a deep latch for the baby so that the baby gets more milk and that you don't become sore, and it helps your milk supply, and then you can avoid being engorged, which is all going to help contribute to your effective breastfeeding. So regardless of what position you choose, there are 4 key points that we like to use with position and latch, and your baby seems hungry. So we're going to go over your position, the baby's, bringing the baby to the breast, and signs of a deep latch. So the first thing is your position. So you'll be sitting up, so you're a little hunched over. We want to sit you up nice and straight, and we want to make you comfortable. So make sure let's fold this over and just position your elbow. So you want to be in good position. Your baby also wants to be in good position. So the head, shoulders, and hips should be in alignment. Your baby should be close to you. If you're holding it this way, the belly should be up against your chest. Make sure the head is, there you go. And then you can hold the back of the neck. You never want to hold the back of the head there. And you can hold your breast with this hand. So we have you in position, we have the baby. Now we're going to bring the baby to the breast. So you're going to put the nipple to the baby's nose. Make sure you wait till the baby opens the mouth wide, and then you can latch the baby on. And there you go. And then you're going to look for the signs of that deep latch or effective feeding that we went over earlier. So the cheeks are nice and rounded, there's no noise. The baby is content and not agitated and maintaining the latch right now. So they're all effective signs.
Okay.
How does it feel for you?
It feels good.
Good. So your nipples aren't sore, so it's not painful. So I think we're doing well. Do you have any questions?
Not right now.
Okay.